More than 3 million people in low and middle income countries die each year as a result of lack of access of essential medicine. According to the CEO Emmanuel Akpakwu, the trend poses a threat to the health of patients in need of the essential drugs. Financial constraints and systematic inefficiencies were also cited as factors that also deny users of life-saving treatment.
According to ACMED organization, at least 3.5 million deaths in low and middle income countries are attributed to lack of access to proper and efficient medication. Speaking during the ACMED inaugural summit in Nairobi, the organization's CEO Emmanuel Akpakwu said the trend calls for urgent and radical collaboration of both government and private healthcare partners to fill the existing gaps.
We've seen patients go without, especially in cases where those diseases could lead to very difficult outcomes. So our goal is very simple. Make sure that we can showcase the full strength of demand that comes not just from the African continent, but across every low and middle income country. But of course, charity begins at home, and so we're starting here.
Further, the organization revealed that 1 in 10 medicines are counterfeit, resulting to inconsistent treatment outcomes, which further jeopardize patients' health.
Counterfeit and substandard medicines have been a pain for a lot of patients and a lot of providers living on our continent, but also across low and middle income countries.
No single entry can tackle this complex challenge alone. We must adopt a collective approach that brings together government, the private sector, civil society, in innovative partnerships.
Women rights crusaders led by representatives from the Office of the President's Advisor on Women Rights, Harriet Chigai, noted safety and quality care in health facilities and enhancing health literacy among people in the underserved regions is key in reducing maternal deaths.
Women and girls also bear the brunt of unpaid caregiving responsibilities, limiting their ability to seek timely medical care and afford medicines. Chronic shortages of medical supplies and personnel, particularly in rural hospitals, further exacerbate their crisis. These facilities struggle to meet the growing demand of basic health care services, leading to congestion and delays in service delivery.
Health Cabinet Secretary Deborah Baraza, who graced the inaugural summit, said the government is adopting key strategies such as pool procurement in support for local manufacturing of medical supplies to strengthen the country's health system and minimize stockouts.
Through pooled procurement, we harness the collective purchasing power of health institutions to negotiate better prices, ensure superior quality, and minimize stockouts. This approach enables more efficient resource allocation, allowing us to reinvest in critical areas such as disease prevention, infrastructure development, and primary healthcare services.
John Kahiro, Prime Edition.